What's up guys, Dr. Natty at Myokinetics. So today I'm gonna go over how you guys can warm up your lower body, especially if you have hip, knee injuries. This is some of the best warm up that I do personally myself, and I give to all the patients that actually come in here so that way they know how to warm up inside the clinic and outside the clinic. So this is my go-to routine before I even do my lower body, before I do anything athletic. So let's just get into it. The biggest thing that I want you to know is that this warm up is supposed to loosen your muscle, activate your muscle, and prepare you for the lift that you're gonna have for your lower body days. All right guys, first thing we're gonna do, we're gonna foam roll. So I like to foam roll my spine, making sure like my back, everything feels really good before I start putting load on my back to do my lower body. So the first thing we're gonna do is we're gonna hop on a foam roller. From there, I'm gonna support my head, and I wanna do this 10 times. I'll do this with you guys, so just walk it through with me, okay? So I'm gonna go up and down from upper back to mid back, and I'll do this 10 times. And like, I'm just trying to warm everything up, like all the paraspinals, all your mid back, especially if you're sitting in class all day or sitting at work, you know, these muscles get really, really tight. And it's really gonna be really good to help with your posture. So after 10, I'm just gonna hang out and my mid back, drop my butt down. And then from there, I'm just gonna slowly let gravity take over, and I'm gonna extend my back a little bit because we're always in this position of us hunching over. So now we get some really good back extension. So if you guys have a nice crack when you do this, that should feel really good. We don't want anything to have pain when you do this, okay? Next one, we're gonna actually roll out your quads, your hips to make sure you feel really, really good. So the first thing I like to really get is this little muscle right here, your TFL. It's actually control how your knee rotates. So if your knee rotate in, it's not the best for the middle part of your knee. So you're gonna have a medial stress. So we wanna make sure that we foam roll these guys first thing first, right? So I'm gonna show you my left side. So I'm just gonna lay where my front pocket is, bring this leg here to support. And all I'm gonna do, I'm gonna go up and down. And this muscle is only like 1 inch. So you're gonna feel like the tenderness already. Once you find it, you're gonna hold that there, and I'm gonna rock side to side 15 times. So if you guys have that IT band pain when you're squatting down or when you're lunging, this is a really good rolling thing that you can do. And your IT band is actually connected to the TFL. So if you guys do this 10 to 15 times, switch sides, do exact same thing, okay? Next thing I'm gonna do, I'm gonna foam roll my hips. So from there, I can just get into here. My sit bone is gonna be right on the foam roller. You have two options. You can bend this knee, keep this right here, lean in and just go up and down. Right? I'll do that 10 times and you can see my face, like I got some tenderness there already. Now, if you don't feel that much, you can cross this leg over and do this as well. This one, you're gonna get a more intense foam rolling, you know, hip pain or back tightness, especially after sitting a lot. This is gonna be a really good thing for you to do. Sometimes you get your piriformis, which is the muscle that actually can compress your sciatic nerve. So if you have sciatic symptoms, give this a try because this is gonna help you warm up a lot. I'll turn, shift this way, go up and down 10 times. Warmed up our spine, our mid back, our lower back, our hips. And the next thing we're gonna do, we're gonna go into our quads. I'm sure you guys seen it before, where people just kind of laying, going up and down. But what I really like is to add some movement into the quads, right? So if I crawl here, up and down for 10 times, what I'm actually doing, I'm finding out which part of my quads is the most tender. So once I find it, which is around here, I'm gonna hold that right there. I'm just gonna kick and extend. And I'll do that 10 times. So when I do this, it's actually help me loosen up my muscle, increase some range of motion that might be restricting before I do my squat or my deadlift. You know, you should be able to get this done in literally less than 10 minutes. So right now I feel my hip flexor loosen up, my quads loosen up. And I'll tell you what, you guys might not notice, but your quad's actually connected to your flexor. So if your quad's tight, your hip flexor is gonna be tight. If you're sitting a lot, you know this is gonna help you a lot. And also, for those who have knee pain in the front, rolling out your quads is gonna really help you get rid of that knee pain. Next one, we're gonna foam roll our calves, which is literally one of the tightest things because we use it every day. I like to just place some gentle pressure, just right then and there, like you just feel the tenderness already, right? So I'll just go up and down, kind of fishing around to see which part of my calf is really tender. So for me, it's always in the middle. So once I find it, I'm just gonna drop my butt down. I'm just gonna put a little over pressure here with this leg, right? And from there, all I'm gonna do is I'm just gonna bring this down and bring this up. So you're just pointing your toes up and down. And it's gonna feel really, really uncomfortable. And again, we want the pain level to be like 3 out of 10 so you can tolerate. Once you guys are finished with this, you're gonna feel so much better because your range of motion in the ankle is gonna be better. If you have more range in the ankle, it's gonna put less stress in the knee when you're squatting or deadlifting or running. So these things are extremely vital. And I know most of the time, you cannot skip your warm-up. Your warm-up, your activation will set the tone of how your workout is gonna be. To me, it's like a really good appetizer before like a nice meal. So think of your warm-up just like that, okay? It's extremely crucial. Lastly, we're gonna do our hamstring. Again, the hamstring, very similar to the calf. Rest one leg on top. You can go up and down. If you feel like this is not getting you a good enough pressure, you can always use a softball underneath this, but then that might be in too much pain. I like to use the foam roller just because it's just gonna get the job done. Okay, so we're just gonna hold that there. You see how it rotates side to side, really get like the inner hamstring, the outer hamstring. And if you don't believe me, I would urge you to do a squat test. So you're gonna do a squat before, and then do this, and then do a squat again so you can see how much better this makes you feel. Awesome, so we're done with that, and let's move on to the next phase, which is mobilization and our activation. Next thing you know, I'm gonna teach you how to actually mobilize your joint. This is something I would manually do if you were in the clinic, but since you're not in the clinic, I can teach you how to do it on your own. First thing you need is one of these mobility bands, and then just a plate, right? So we're gonna go ankle first, all right? Because the ankle is extremely important. If your ankle is really stiff, you can't really get low in your squat, right? So you wanna line up the band, and then I want you to place the band right here between these two bones, your malleolus. You're gonna put this on top right here. So you see I have the tension, the force is pulling backwards. So we want a downward force. From there, I'm just gonna kneel down. And all I'm gonna do, this is important, I wanna think about rocking my knee over my second toe as the band's pulling my ankle back. So you do an ankle mobilization. So I'm just rocking forward. Pay attention not to let that heels come up, really keep it flat, and then come back. And for any of you guys that have knee pain when you're squatting or a pinching sensation in your hip, it could just be because you don't have good range of motion in your ankle. So this is something that you're gonna do, you're gonna feel really, really good. Do the other side. My left ankle, I have sprained it many times playing soccer. So this one, you're gonna see that is visibly more strict compared to the other one. And that's why I'm gonna spend more time holding it, so that way I can really work that range of motion. Pinching sensation in the front of the hips when you're squatting down, this band mobilization would be awesome for you. What we're gonna try to do, we're gonna create more space in the back of your hips, so that way you can load your hips when you're squatting, when you're deadlifting, when you're running, when you're jogging. What we're gonna do is you're gonna put the band, bring it all the way up here, right in the front of the hip. And then from there, all we're gonna do, get into a nice pigeon pose, right? So what that means is that you're just gonna go 45 degrees, just like so, right? So you see the band is pulling my hip back, and that's gonna create that traction so you have more space in the hip. And all I'm gonna do is I'm gonna slowly lower myself, so now I feel even more stretch in the hips here. If you want more, what I like to do is I like to rotate, so my opposite hand compared to this leg, it's gonna rotate through. Now I feel a huge stretch, right? I'm gonna hold that for 3 seconds. Then I'm gonna slowly push away, open that up, and then back down. And I will do this for 10 reps. From this angle, you can see me rotate through, so I get more hips involved. Then I'll rotate out. Guys, don't hold your breath. All this should feel really, really good. There you go. All right, guys, so next one, we're gonna open up the front of the hips. This is gonna be a really good hip flexor stretch. If you're sitting all day, your hips still feel tight after the foam roll, this would be a really good mobility drill for you. Bring this leg through, pull this band up right underneath your butt, and all you're gonna do is you're gonna bring this knee down. The biggest thing is I don't want you to arch your back, I want you to keep your tailbone tucked. Lean forward, you should feel this opening up. Like, this is a great stretch right now. So you've just been sitting all day in traffic, on your way to the gym, this is gonna be really, really good. So we're gonna hold this for 5 seconds. If you want better stretch, it's a bonus strip. You reach up the opposite, and then come back. There you go. So I feel so much better already. Another cool thing about this stretch is that I also give it to my low back pain patient. If they have that tightness in the back, because your hip flexor is actually attached to your spine. All the runners love this kind of warm up right here. All right, guys, now that we have all this range of motion, you feel really good, you want to activate the muscle. The whole point of activating the muscle is that to create that mind-muscle connection so that your brain knows, all right, we're about to do some serious work. Which muscle do I need to fire? The biggest thing is the glutes and the quad, and we can do this all in one shot by just doing the bandwalk. I'm sure you guys seen this before. It's all over Instagram. The way I cue this is that we want to make sure that your hips is hinging back, right? You see that? The biggest thing I don't like seeing is when people start extending their back, because when you start extending, you're actually turning off your hips and you're loading the lower back instead. So if you feel all of this in your lower back, make sure you don't do this. You do the opposite. So you keep that nice and neutral. So now when I face here, I'm loading my hips, I'm loading my quads, and I'm making sure that the band doesn't pull my knees in, but I just keep it straight, all right? From there, all we're gonna do is we're gonna move to the right by pushing off with the left. Most people, they like to reach with this leg to go this way, but what I really want you to do is I want you to push with this leg to go that way. So I'm pushing and I'm coming back. Then I'm pushing, then I'm coming back. And the reason I put my hands here, that's where I want you to feel it, right on the side of the hips. Pushing, coming back, and I would go, boom, right there. I feel everything in my hips and not my back. If you feel your back, you really need to just relax your lower back a little bit more. So if you do this right, within 5 steps, you should feel the burn already and the activation. So these are the muscles you're gonna use when you're working out and when you're playing your sport. All right, so I just did a first set of band walk. Then I'm gonna do it with some goblet squats. So I typically do this in like a superset. So I'll do 3 things at the same time to actually help me warm up. So I already warm up my glutes. Now I'm gonna use the kettlebell to do some goblet squat to warm up my quads and my core. So you can't arch your back because you're gonna feel your back. If you stack your core this way, it's gonna teach you to slowly shift your weight back into your butt and then slowly come down. And then you're gonna come up, squeeze your butt. So from there, the whole point of me doing this for 8 to 10 reps is to get everything warm up, the quads and everything that we're gonna be doing in our workout. Jumping, landing, cutting, squatting, deadlifting. It's gonna be a very similar pattern here. So when I'm done with 8 or 10, I will then go to the bench and do some glute bridges whole to activate the hamstring and the butt even more. What's cool about this one is that it teaches you to activate your butt and your core at the same time. So when you do this, I always pretend there's a glass of water here that if I don't control my hips and my core, it's gonna fall over. All I'm gonna do, I'm gonna reach up, I'm gonna drive my heels into the ground, I'm gonna take a deep breath in, and as I breathe out, I drive and squeeze. And I'm just gonna do that for 5 deep breaths. If you do it right, you just feel your butt and your hamstring firing up. So then, I would do 2 more sets of the band walk, goblet squat, and the bridge hold. And that will be the end of my warm up. Again, if you guys do this correctly, 10, 15 minutes top, but you should feel really, really prepared to do your workout, your running, your practice, your lifting. So this is something I do every single time before I do anything lower body related for myself, for my patient. I hope you guys enjoy this one and give it a go and let me know how you like it. Like, subscribe, and share the video.